Model of the coronavirus spread in the U.S. shows the peak in Minnesota could come in just a few weeks. That's 2 months earlier than the best case scenario laid out by the state.
And Tom Lydon talked to one of the scientists behind the model who believes they avoided a mistake that others have made.
The lack of testing has made modeling of the coronavirus a moving target. We simply don't know how many people are infected.
The way we did our model, which is different from everybody else, we're modeling mortality.
Professor Ali Mokdad is with the Institute of Health Metrics and Evaluation, a group started by the Gates Foundation. His model for Minnesota is based not on infections, but something we know for sure: how many people have died.
We don't know how many people have coronavirus in Minnesota or in Seattle. There are many people who have coronavirus who could be asymptomatic. No sign, nothing. So that's why we're saying it's very important for us to count the dead people, because we know for sure. And then we can reverse engineer that.
According to this analysis, April may be the cruelest month of all. The slope of the curve getting steeper, with multiple deaths a day, peaking around April 19th with 49 deaths in a single day. In this model, hospital admissions closely follow that curve, hitting peak capacity around the same time with a projected 4,500 beds needed and 712 ICU beds, nearly 3 times the current ICU capacity. The model predicts a total of 1,000 deaths. It's a dramatically different scenario than the model the state developed with the University of Minnesota, which, as you may remember, included 2 scenarios. Without any intervention, that model showed hospital use peaking in early April, with more than 60,000 hospitalized, and the peak of the pandemic happening in late May, with more than 2 million infected and a potential death toll of 74,000. But with interventions like the 2-week stay-at-home order and continued social distancing, the state's model shows we hit ICU capacity around June 7th and the peak of the pandemic later that month around June 28th. 3 dramatically different scenarios in 3 different months. Today, the governor said, don't get caught up in the numbers and dates. It's about the trend lines.
Everything we're doing was a sense of urgency to err on the front end side rather than the end. I think the more specific ability that we have here lends me to believe that, probably like so many things, it's probably somewhere in between the two.
When you look at the health profile of Minnesota, you guys do better than other states.
Professor Mokdad says Minnesota has some things going for us, like a healthier population, a robust public health system, and at least for now, we appear to be taking social distancing seriously.
If there is any message here from this interview, is for all of us to stay at home, and then we can reduce this burden. We can get out of it with less harm, and we don't lose the people that we love and we care about.
The model Minnesota is relying on does have more state-specific data, and officials plan on rerunning that model very soon to see if mitigation efforts are actually working. But Dr. Mokdad's model, which is being updated every single day, is really a mixed offering. It shows the pandemic in Minnesota may not be nearly as bad as we feared, but we may not have nearly as much time as we had hoped. Tom Lydon, Fox 9.